taking care of a child requires extensive knowledge in several subjects, one of which being how to avoid giving your child shaken baby syndrome. In this video, we will answer questions such as, what is shaken baby syndrome, and how does shaken baby syndrome affect my child? What is shaken baby syndrome? Shaken baby syndrome is a serious brain injury that comes as a result of shaking an infant or toddler. It also has other names, for example, abusive head trauma, shaken impact syndrome, and whiplash shakes syndrome. How does shaken baby syndrome occur? Things like gently bouncing a baby on a knee or riding in a bumpy car won't cause the problems seen in abusive head trauma. Abusive head trauma happens when someone uses force to shake a child, uses force to throw or drop a child on purpose, hits the child's head or neck against an object like the floor or furniture, or hits the child's head or neck with an object. Shaken baby syndrome can destroy a child's brain cells and block oxygen access to the brain. It can also lead to permanent brain damage or death by causing bruising, swelling, and bleeding in the skull. What are the symptoms of shaken baby syndrome? Symptoms of shaken baby syndrome include extreme fussiness or irritability, difficulty staying awake, breathing problems, poor eating, vomiting, pale or bluish skin, seizures, paralysis, and coma. However, in milder cases of shaken baby syndrome, children might move less than usual, be cranky and hard to comfort, throw up, have trouble sucking or swallowing, eat less than usual, not smile or coo, seem stiff, have seizures, have trouble breathing, have skin that looks blue, have pupils that aren't the same size, be unable to lift their head, have trouble focusing their eyes or tracking movement. If your child is showing any of these symptoms after they have been shaken, you should immediately take them to the hospital. Parents or caregivers often won't say that a child was shaken or hit, so doctors may not know to check for head injury. Many signs of abusive head trauma, like fussiness and throwing up, are common in routine child illnesses, so it can be hard for doctors to know that a baby was harmed. If abusive head trauma is suspected, doctors will do an eye exam to look for bleeding inside the eyes, order x-rays of all the bones to look for new or healing breaks, which happen most in the arms, legs, skulls, and ribs, order a CT or MRI of the head to look for broken bones, brain swelling, or brain bleeding. What can help a child with abusive head trauma? After abusive head trauma, a child may need long-term care from a team of health experts such as brain doctors who specialize in neurology, brain surgeons who specialize in neurosurgery, eye doctors who specialize in ophthalmology, and hormone doctors who specialize in endocrinology. They also need a pediatrician who can manage their ongoing complex care. They might also need support from therapists such as rehab medicine, speech-language therapy, and physical therapy. Before age 3, a child can receive free speech therapy or physical therapy through state-run programs. After age 3, the child's school district provides any needed special educational services. As children get older, they may need special schooling and ongoing help to build language and daily living skills like dressing. Your child with extreme care. Ask for help when you need it. One of the main ways that parents accidentally give their child shaken baby syndrome is stress, causing them to act irrationally. It's good to take a break every now and then. And you should also educate others about the dangers of shaken baby syndrome and the risk factors that lead to shaken baby syndrome. A lot of the reasons that children shake their babies are preventable or mistakes. These include unrealistic expectations of babies, young or single parenthood, stress, domestic violence, alcohol or substance abuse, unstable family situations, depression, and a history of mistreatment as a child. Complications. Shaken baby syndrome can lead to things besides death, most of which are permanent, that being partial or total blindness, developmental delays, learning problems or behavior issues, intellectual disability, seizure disorders, and cerebral palsy.